chronic granulomatous disease will develop infection with this catalase positive organism repeatedly. So the catalase positive organism are Staphylococcus, Klebsiella, Serratia, Aspergillus. Okay, so these catalase positive organisms, CGD patients suffer from chronic recurrent infection with the catalase positive organism, and that is the important. Okay, so catalase, this, how can we demonstrate the patient with NADPS or oxygen deficiency? The failure of phagocytic cell to generate the oxygen radical are easily detected by the nitro blue tetrazolium reduction test or neutrophil oxidative index, flow cytometry assay, or dihydroadiamine test. So there are 3 tests. That is the NBT test, that is the NOI test, and dihydroadiamine test. So these 3 tests can be used to detect the NADPS oxidase is missing or not. Okay, if you talk about this NBT test, what will happen? In NBT test, we incubate in the presence of nitro blue tetrazolium. If normal, that is for Forsman positive, purple blue. So if the oxygen is present, is this NADPS oxidase is present, they will produce the oxygen, so they will convert into the blue. If there is no NADPS oxidase, this will remain the same, and if the test remain the same, means the patient has deficiency of this NADPS oxidase, and we diagnose this chronic granulomatous disease in this way. Okay, so hope this is a very important topic. This is a very important lecture. We have to know detail about it. Okay, so now we can talk about this one important thing, that is the systemic inflammation. And systemic inflammation, we know that during the acute inflammation response, pro-inflammatory cytokines such as interleukin 1, 6 and TNF are produced. These cytokines have systemic effect on the tissue, including fever, production of acute phase protein, and leukocytosis. So during local inflammation, there was production of this interleukin 1, TNF alpha, interleukin 6. What they will do, they will act on the different part of your systemic circulation. By systemic circulation, they reach to the different system. They will act on the hypothalamus, produce the prostaglandin, and develop the fever by interleukin 6, TNF alpha, and interleukin 1. They will act on your liver and helps to produce of this acute phase protein like CRP, mannose binding protein, and complement component, which is responsible for fighting your infection. Thus there will be CRP, mannose binding protein, and complement protein that is released from the liver due to the interleukin 1, TNF alpha, and interleukin 6. Okay, they have produced same effect on the hypothalamus, and prostaglandin was released, that released to the fever. There was also this interleukin 1 and TNF alpha acts on the bone marrow and cause leukocytosis. So more and more cells will be produced, and more this your policeman, your army will go to the into peripheral blood circulation and then to the tissue injury site and act and try to win the war, try to kill the bacteria or all the foreign invader. So these are the systemic effect of your local acute inflammatory system. Okay, so hope you have understood. This is a very important chapter. This is a very important concept to deal with the USMLE question, and there will be one question on it. Thank you.